you so much for everyone who's attending this webinar and to, of course, our speakers and guests. I first would like to just give a shout out to my co-director of this program, Dr. Deborah Axelrod. She is the professor of surgery and director of clinical breast surgery. And one of her passions is community outreach, and she was the founder of the community outreach program here. I am so pleased and honored to say we are colleagues, friends, and she is a brilliant breast surgeon. And we are going to coordinate this program together and hear from our wonderful speakers. Before we do, just a few words about cancer in general. As most of you know who are on this webinar, cancer is a very unique journey, and most conferences we hear about the medical issues of cancer and the journey of cancer, but Faces of Cancer, which we've been doing for many years now, is very special in that it tells us about the personal, unique journey of our patients and of people who have gone through cancer treatment. Every year is different because our participants are different. This year, we have three remarkable people that we're going to hear from. So without further ado, I will give the floor to Dr. Axelrod to tell us about our speakers. And I hope everyone enjoys the program and really takes to heart what these people are saying. It's very meaningful and very wonderful way to understand what cancer is all about.
Before I introduce our first speaker, I would like to say that I am a 24-year survivor of breast cancer. So, these panels are really impressive, and I wish I had you, Marleen, on my team when I got diagnosed, and through the many years, that you've been doing these wonderful programs and offering great services to people that not only help them physiologically, but help them mentally as well.
Thank you.
So really, it's an honor to be working with you. Okay, so our first speaker, Bahati Vojala, and I think I've pronounced that right, is an epidemiologist. So she's coming from both sides here. She's a 3-year survivor of stage 2B signet cell or signet ring cell gastric cancer, diagnosed in her early 30s after persistent acid reflux led to the discovery of H. pylori and cancer. Surgery and chemotherapy followed, marked by a brave fight to add immunotherapy to prevent a recurrence. She now advocates for early detection and screening in young adults and also mentors other young patients navigating a gastric cancer diagnosis. But you also work for the Department of Health in New York. So you have a terrific, multifaceted experience. Thank you for speaking.
Thank you, Dr. Axelrod. I actually work for NYU Langone. I'm at Pop Health, so I'm happy to be here. Thanks for having me here. I'll go through my story and my journey of how I came to be a 3-year gastric cancer survivor. I was first diagnosed with stage 2B signet ring cell gastric adenocarcinoma when I was 31 years old. I was in a PhD program. I was recently married at that time, and I was just building the life that I had envisioned. I was trying to finish off my program, applying for jobs, and going through that whole process. My husband and I had been married for a little while, recent, newly still, but we were starting to think about family planning and we wanted to start that process. So we were starting that process and I was getting multiple negative pregnancy tests. So I think I had about 5 negative pregnancy tests before I went to my doctor and I wanted to talk to them about what's going on. I wanted more fertility testing. I wanted to know what I can do to improve my fertility to move this along. But at the same time, I had some other issues that I was facing. So for about 7 years prior to my diagnosis, I was suffering with chronic acid reflux and GI-related side effects. I have no family history of cancer whatsoever. I was active. I was quite healthy. I was eating well. Yeah, I consider myself fairly healthy. And so when I started experiencing these persistent symptoms or reflux and GI discomfort, I went to multiple doctors. But this was during a period of my time where I was also moving a lot. I was starting a master's program, then I started a PhD program. So I was moving around and seeing different providers and different doctors. So I didn't have one consistent provider that was following my journey. And every provider, looking at my age, I was in my 20s at that time, told me to change my lifestyle, told me to eat better, don't eat too late at night, don't eat spicy food, etc. But something in me knew that this wasn't normal. I kept pushing for multiple tests, and actually, in the beginning of 2020, they had ordered an H. pylori test for me, which is a bacterial infection that is known to, if left untreated, cause cancer. They sent me for a breath test. They wrote a breath test for me. I was traveling in the beginning of 2020. So when I came back in March of 2020, I said I would sign up for this. And then promptly 2 weeks later, the world had shut down and they were no longer doing breath tests for H. pylori because that was no longer a priority at that time. And because of that reason, my testing was just pushed back further. And in 2021, in October of 2021, I had so much pain that I was keeling over on a 40-minute drive. I couldn't sit in the car for 40 minutes. We had to keep stopping so I could relax a little bit. And I had gone to the ER, again, dismissed that it was just acid reflux. And at that time, I was adamant and pursued a GI. And we found, through an endoscopy, found that I did have H. pylori and a massive ulcer. So this was all happening while my husband and I were also thinking about family planning. And I had gotten my negative pregnancy test, the last negative pregnancy test, in January of 2022. By this time, I had been treated for the ulcer. I was feeling great. I was eating better again. I had no reflux. I had no symptoms. Life felt really great, and just thought our next steps would be, to move forward with building our life together. And I went to see this doctor about my fertility, and she said, I see you have a repeat endoscopy coming up in February. Why are we talking about pregnancy right now? And I said, I'm not going to that. I feel great. I don't think I need to go. Everything's good. I feel really, really great. I have no pain. I have no symptoms. I'm not going. And she said, okay, well, I want you to just go to that endoscopy, get that clearance, make sure it's nothing else. And then we come back and I'll do all the testing that you want me to do. And we can talk about fertility and we can talk about next steps. So I went to that endoscopy, and during that endoscopy, we found a massive tumor that was hidden under the ulcer this entire time. And it was a very aggressive, rare and aggressive form of stomach cancer, the signet ring cell type. And I was diagnosed as stage 2B because it had already spread to 2 lymph nodes. Of course, from that moment, my life completely changed. It was not the news that anyone would want to hear, especially in your 30s. I was 31. Within weeks, I moved forward with genetic testing just to see if I do carry any genetic markers like the CDH1 mutation. I do not carry any genetic markers for this. So my care team, my wonderful care team, thought that I was earlier stages than stage 2B, so they moved forward with surgery first. So they actually did a subtotal gastrectomy for me where they removed 80% of my stomach. And the pathology from the surgery showed at that time that it had spread to 2 lymph nodes, so it was node positive disease. And I had to go through 12 rounds of chemotherapy of FOLFOX, followed by immunotherapy. And in my bio, you had said a brave advocate for immunotherapy and fight for immunotherapy. It's because in 2022, immunotherapy was not approved for stomach cancer patients who were non-metastatic. So at that time, I was stage 2B. I was not considered a stage 4 patient, and therefore I was not eligible for immunotherapy. But I had the PD-L1 marker, which is known to be required for the immunotherapy that I could have gotten. And so I kept talking to my doctor, who is so wonderful and so sweet and patient to deal with a patient like myself, because I would keep coming in with all these papers that I would read and all these scientific papers that I would read. And I'd come into every appointment and I'd say, Doctor, oh, this is what I read. Why are we not trying this other option for me? Are you sure that I'm done with chemo? Or do I need maintenance chemo? Can we do something else? Because what I found out through all of that reading was that for most cases for gastric cancer, we have the highest chance of recurrence within the first 2 to 3 years. So what I wanted to know was why I wasn't in treatment for the first 2 years. I didn't want to just go through chemotherapy and stop and kind of let fate have it. So after a lot of back and forth and advocating for myself, I was also able to receive immunotherapy for a whole year. So I completed chemotherapy in October of 2022, and then I did immunotherapy from January of 2023 until December of 2023. So it was a long process of treatment for me. And of course, recovery was very, very intense. The chemo that I was on, it, it was mild, but there were some side effects that I had dealt with. My port had gotten infected during that whole process, and then I had to get the port removed, get a PICC installed, and go through, receiving treatment with a PICC. I also had the usual side effects that you would have with chemo, but I think for me, my recovery was most intense after I completed chemotherapy, where I was emotionally processing everything that had happened over the past year. I had also taken a break, of course, for my PhD program, so there was a lot to get back to as well if I wanted to continue that and pursue that. So it took me some time throughout the year of 2022, after my surgery, after chemo, to really learn how to eat again, to learn what my body could sustain, to eat slowly, to make sure I'm not eating anything that would cause me pain or discomfort. Um, my digestive system had changed completely, so I had to relearn this new body that I had, and I had to also grieve this life that I had envisioned for myself. I never thought I would be a cancer survivor or patient in my 30s, and let alone deal with all the other side effects that comes with it. For fertility, we did end up harvesting some embryos before I started chemotherapy. So that was some insurance policy, something hopeful that I was looking forward to. But I did have to, I grieved a lot about what I had experienced in this life that I had envisioned for myself, for my husband, and I had to grieve the loss of my old self. But my family was my biggest strength throughout this whole process. My parents, my husband, my brother, my dog, they became my caregivers and my strength throughout this whole process. They took care of me 100%. They were my nurses and my drivers and my chefs, everything that you could think of. And I'm so grateful that I had such great support and with my friends and my family, and they really carried me when I couldn't carry myself. There were moments throughout chemo when I had so much pain that I couldn't go up the stairs to get to the bedroom, and so my husband would quite literally had to carry me upstairs. So it it was a it was a long and arduous process, but I'm really glad to be here today, June 2025, where I'm now 3+ years out of this ordeal and I'm considered a survivor. I want to talk a little bit about my advocacy work and what I do for advocacy as well. Right now, I actually started doing some advocacy work as soon as I completed chemotherapy. I got involved with an organization called Hope for Stomach Cancer. I was looking for support groups for stomach cancer patients specifically, and I wanted to see more stomach cancer patients who looked like me. And by looked like me, I mean my age. They're seeing a young patient and talking to them about the struggles that young patients actually face. And so I was able to work with Hope for Stomach Cancer, met a lot of great patient advocates and survivors and patients throughout that organization. And I'm actually now a patient advocate I volunteer my time being a patient advocate for Hope for Stomach Cancer to really elevate awareness for rare cancers like stomach cancer. Stomach cancer only accounts for 1.5% of all new cancer cases in the United States, but it's also the fifth leading cause of cancer deaths worldwide. And while it's rare in the US, it's quite common and prevalent in other parts of this world. And it is a very, very, very aggressive type of cancer. The 5-year survival rate hovers around 35%. So it's important that we start allocating more research and more funding and more time for rare diseases like stomach cancer. And the work that I do for advocacy is really focusing on early detection and patient education. I'm blessed that I can understand scientific papers, and I do have this educational background, which I try to use to help other patients understand materials that they're not able to fully understand. So I'm translating these materials for our organization. When I go to large conferences like ASCO or AACR, I'm the one sitting at all the panels and all the presentations and taking notes and making sure I bring that back to my community so they understand what the new research looks like and what this means for standard of care, what this means for their own specific diagnosis. So my goal now is to really amplify more stories like mine and to provide a face for young people with gastric cancer, and to talk more about issues that young adults face when they are diagnosed with cancer, like fertility loss, like sexual education. I think these are a lot of things that are often not talked about for a cancer like mine because the average patient is 65 and older.
That was remarkable. Thank you. I am very interested in health literacy. So, and it sounds like you're right in the thick of things with education materials. What grade level do you gear your education materials to?
I try to put everything into layman's terms. And so I'm not creating actual materials, I'm having conversations. So it really depends on who I'm speaking with and what their experience is like and what their awareness and understanding is. So instead of creating full on materials, I'm breaking it down for our medical writer for our organization and the founder. So I speak with her about all the notes that I had taken, and they go back and create those materials for the group. The work that I'm doing is speaking with patients one-on-one and talking to them about their situation and then referring them to certain papers and explaining those papers to them.
That's terrific. I feel like I feel like we don't do as good a job as we can with giving out materials that can be understood. So I think the rule of thumb is like fifth grade. Marlene, I don't know if you want to say anything about that.
Yeah, I think a lot of the information that we give our patients is written at a fifth or sixth grade level, but as you so eloquently said, this is a very rare cancer, and we do a pretty good job for breast cancer because it's so common. And there's lots of written stuff out there. But for the rare cancers, there's very little written. Most people, if you told them about stomach cancer, they don't know a single person that's had it.
Yeah.
So I think the work that you're doing is really remarkable and so special. And if I could just ask a question, is there anything, when you finished treatment, is there anything that you wished you had known at that point in terms of what the next few months of your life would have looked like?
So when you're getting something like bariatric surgery, there's a lot of counseling pre-surgery and post-surgery that people go through, right? So they are receiving nutritional support, they're receiving mental health support, they're receiving a whole host of integrative services that helps them prepare for this new body that they would have to get used to, this new normal. And like I had mentioned briefly, everything shifts. Your stomach is so important for you. You're eating all this food, but then you now have to learn what you can eat, how you can sustain your energy. So I wish I had advocated for that a little bit more because of how quickly things were moving for me based off of my age and based off of how aggressive my cancer was. Um, I didn't have a chance to go through that counseling. So I wish that, and I only learned about that after. I learned about it through other patients actually and other advocates, and by going to patient summits and going to different conferences. So I wish I had advocated that for myself a little bit more. It was a lot of trial and error. I'm also South Asian, so the foods that the nutritionist recommended for me before I left the hospital were foods that I was not going to eat. I mean, she said you can have a little bit of salt and no pepper and no other spices. And I said, well, I kind of need some spices. And so I spoke with my surgeon, who was also South Asian, and I had said to him, I said, Dr. Shah, I need to eat some spice. I can't, this is not what I'm used to. And he's like, it's okay. You have to just go back to whatever you were eating, not too spicy, but just try to, it's all trial and error for you from here on out. We can help you manage it, but you have to see what works for you and what doesn't work for you, but keep it as normal as it was before. I had also lost, I wasn't a very heavy set person before I had gotten cancer, but I did lose a total of 25 pounds, which in the grand scheme of stomach cancer, that's actually not a lot of weight that I had lost. So I'm very grateful for that. But I did lose a major amount of it after surgery. And then throughout chemo, I lost about 5 pounds, and I tried to sustain that during the entirety of my treatment. Um, what I've learned a lot throughout this process is that living as a stomach cancer survivor requires a lot of effort that goes into the way you eat and the way you live your life. You never know when you're going to get dumping syndrome. I could be out and I could be eating something, I could be eating fries, for example, and it's just that oil and that's fried a little too much for me, and I could have dumping syndrome when I'm out.
Can you explain what that is?
Sure, yeah. So dumping syndrome is a side effect of surgery that we have. When I think bariatric surgery patients also have this as a side effect, but essentially it's when your stomach is not able to process the specific food that you are eating. And so for me, it's a lot with sugars. So if I eat any dessert or anything too sweet, my stomach is not able to break it down, and it pushes it right into the intestines, and it results in diarrhea, but it also results in chills, fatigue, sweats. It's low blood sugar essentially when you are going through that. And for me, I personally feel like I'm going to faint and pass out, but at the same time, I have severe pain throughout that process. And so, dumping syndrome was something that I had experienced throughout chemo, and then I learned to manage that. And one other thing that I actually wanted to touch on in my recent survivorship life is that for my 3-year anniversary this year, I was pregnant, which was very, very exciting for me. I had done a frozen embryo transfer. I had gotten it cleared through all my physicians. I went to every single doctor I possibly could, and MFM, everyone. I had gotten it cleared and did an embryo transfer. We were so happy that it was successful and it was moving along. But once my beta HCG levels started rising, I was having dumping syndrome 3 to 4 times a week. And it was very abnormal, and it wasn't going away. It wasn't going away until one day it went away, and I found out that at 9 weeks, at 8.5 weeks, I had actually miscarried and I had lost my pregnancy. And now I'm no longer allowed to carry. So not only did I lose my pregnancy at that time, I also lost my fertility for myself. I have gotten conflicting um, advice from my physicians. My oncologist is not concerned at all about a recurrence for me in the stomach because of the pregnancy, because this pregnancy is not this cancer is not hormone dependent. But I also had gotten advice from my GI to not carry again because he's concerned that the dumping would continue throughout the entirety of the pregnancy, and it would leave me with little nutrition and the baby with little nutrition. So after receiving many conflicting reports after this pregnancy, my husband and I decided not to move forward with another transfer, and we now have to go down the path of surrogacy until hopefully one day I can try again in the future once I'm further out from treatment and chemo and surgery. But survivorship has been very difficult. These things come and go. Dumping syndrome, I thought, was long gone for me because it hadn't been happening for me after that initial year. I learned how to manage my body. And then it came with a vengeance when I was pregnant. And the whole time I kept thinking to myself, you've been through so much. You have gone through surgery, you've gone through chemo, you've gone through immunotherapy, and then you went back and got your PhD. You can get through pregnancy. And no, I really couldn't. I was stuck on my couch the entire time, and it was the most difficult thing that I had experienced. So I'm still learning to live in the in between right now of survivorship. It's this space that is in limbo for me between fear and hope and between trauma and healing. And um, I'm learning that it's not really a straight line. Some days I feel very strong and empowered and tell myself all of these things that I've been through and how resilient I am. And then other days I just carry so much fear and anxiety and these physical side effects too. So I'm learning to use my voice and talk about this some more because we don't have any data on fertility for young women who have had stomach cancer. So I'm trying to bring more awareness to all of these different topics for young adults who are going through gastric cancer.
Thank you very much. So just something like that, I'd like to point out that in 2050, there will be more cancer survivors than people who are diagnosed with cancer. And about 3/4 of them will be over the age of 60. And with that comes a lot of chronic problems. So not that we can look forward to something like that, but we can look forward to living hopefully long lives. Many thanks to you. So now I would like to introduce Tracy Moore. Tracy is a 13-year breast cancer survivor. Her cancer journey has given her strength and resilience, and she is blessed to find continued joy in visiting Disney, taking scenic Disney in Florida, right?
Yes.
Disney, right? Okay. Taking scenic road trips and paying it forward by supporting others. So Tracy, it was really nice also to speak with you beforehand. I look forward to hearing what you have to say.
Hello. Hi, good evening. Um, uh, let's see, my journey. Oh boy, where to begin? Well, let's see. In 2010 of October, I thought I was going to have a routine mammogram. Just go in, okay, thank you, and go on to work. And then the next thing was that slow step person coming to you to say, I need you to stay for a few minutes. Um, and it was kind of like I didn't pay any attention to it. I didn't think it was too serious. And then the person who reads those mammograms came to me and said, we need to speak. And that's when everything changed. And at some point, the words that I was hearing became blah, 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 blah. Um, but as mentioned, I love all things Disney. There was a huge family gathering that was going to take place in December of 2010, and I was like, okay, I gotta do this trip before I embark on on surgery and treatment and this and that. So I did the trip, and January of 2011, that's how I brought in the new year, um, had the surgery. My diagnosis actually, to go back, it was um, stage 1 for the left breast, but it had already spread to lymph nodes. Um, so therefore, the surgery that I had in January was a lumpectomy with the removal of all lymph nodes on that left side. Um, I take a deep breath and I pause to say that I know for sure it could have been worse. Um, and I am grateful that it wasn't. Um, my treatment regimen was 18 rounds of chemo, followed by a 1 month break, and then 10 days of radiation therapy. Um, to say which was worse, the chemo or the radiation, I think it's kind of neck and neck. Of course, the chemo makes you weak and tired, and uh, most people, I believe, have they end up losing weight when they get chemo. My body did just the opposite. It blew up. And so by the time I finished everything, I was about 300 pounds. Um, and just grateful to be alive, but I knew I had to do something about the weight. Um, the important thing as far as the treatment journey was just that the care team at NYU was remarkable. They were attentive. They answered all questions. Um, I was that person being a person of color. Well, how do we know that this particular cocktail of chemo is for me? Um, there's no cure for cancer, right? So whatever that's being done is kind of like, well, this is the general treatment. Or someone with your diagnosis, this is kind of like the regimen. So it's kind of like a trial and error. Um, again, here to tell the story. Um, but it was a difficult trial and error, rest assured. Um, y- you can very easily go down the rabbit hole of why me? What did I do? Um, am I going to make it at the end? And I say that the most important part was uh, going to the support groups that NYU does and still does offer. Um, being able to talk to other people who are going through what you're going through. It doesn't matter what kind of cancer, but it's the whole, we have something in common. Um, and you don't want to be defined by what you have. Um, but it was also, it's a new way of living, right? There is now, you have to change what you do, how you do. Um, your mental, physical, and emotional state are just as important as the treatment. Um, your circle of people, family, friends, coworkers, also so important. Um, but I would actually really say that ask questions. That's what I did. I asked so many questions because, again, not to sound like a broken record, being a person of color, it's about early detection. Go out there, don't go with that mindset. If it ain't broke, don't worry about it. No. Um, early detection is, I think, what saved me. Um, and knowing that science and medicine have come such a long way. I first had that look about being scared about cancer because my aunt, um, she's now deceased, but she had cancer. And back in the day, they just gave you a bucket, put you in a folding chair, and walked away. Now you have, the infusion team, they are monitoring you. They are watching you. They're talking with you. Um, you're comfortable. You can get a massage. There's conversation, and all these things are so important to the healing process. Um, and for me, I was glad to align myself with NYU, and all the multifaceted ways that they can take care of each and every patient that comes through their door, irregardless of the stage of their diagnosis. Um, as excuse me, as Dr. Axelrod said, I'm all things Disney. So the first thing as soon as I finished radiation, I was like, okay, so how long before I can travel? Okay, Tracy, hold on, slow down, wait a minute. You got to let your body heal. And it's like, okay, all right. But definitely that was the first trip my mother and I took. We went to Disney. I was on, I was using a cane. Um, and if anybody knows anything about Disney, there's a lot of walking. Before they started counting steps, I can tell you to this day, you can do at least 30,000 steps. Um, the fact that I went is just speaks volumes about what we all, as cancer survivors, perseverance, resilience, fortitude, um, to look for what's next, to know that your story isn't finished. Um, and to that, I will say that to everyone, no one likes to go to the doctor. Go to the doctor, head to toe, get checked out, leave nothing to chance. Um, you know, how I pay it forward is, again, people in my community, people of color, they really don't go to the doctor. They wait and then it's too late. So um, I talk about being a survivor. I talk to those who they're not sure what they have. Maybe they need somebody to go with them to the hospital, to a doctor, to an appointment. I'll do that. I will definitely donate my time and do that because there's no reason to live in fear. There's enough stuff out there in the world today, right? That so um but I know that for sure. Each day that right now, being a 13 to 14-year survivor, I take nothing for granted. Um, and I've become a hypochondriac and I go to the doctor for everything now. Um, but I know for sure that you stop and smell the roses right now. When you have a diagnosis, everything that you do is going to be significant. A friend of mine said, Tracy, you're now living your life with purpose. And it's true. Mean what you say and say with what you mean. Um, and just really listen. I think the difference for me right now is I now listen to people. Before I used to hear people, but now I listen. And there is a difference between hearing and listening. Listening, you're actually soaking up the words that they're saying. Hearing, it's just in passing. And I give you an example. How many times have we said good morning to somebody? Hey, how are you? And you keep walking. So you really don't care how the person is doing. It's just a matter of conversation now. And you just keep it moving. Whereas something as simple, you're at a restaurant and the waiter says, hey, I'm Fred and I'm here to help you. And I go, hi, Fred. And he goes, oh, hi. Because no one stops to take 3 seconds just to acknowledge. So I think for me, the my journey has made me just more aware of a lot more things, not just with myself, but with other people. Um, they say that right now the push is mental illness and mental awareness. Depression is real. I can tell you that depression is real. You can easily become depressed. Like I said, you can end up in a quicksand sort of emotional state because you don't know what to do, how to do, or what to expect. Um, which is why I say you have to have, even if you have one person, you have to have that one good person that you talk to about anything and all things. Um, whether it's a friend, someone, in the religious community, whatever it is, you just have to have someone to speak to. Um, and make it a worthy person. You just don't want somebody who's just going to nod and yeah, yeah, I know what you're saying. Um, it's very important to have a good support system. Um, and really, I appreciate all that NYU does offer. Um, I mean, when we say care team, we don't realize what that entails. And, you know, it was not just the surgeons, it's not just the infusion nurse. I mean, it's a whole experience from when you walk in the door, from when you check in, and all that, all the good vibes, the positivity that you get, that's what you need. And that's what I walked away with after every infusion. It was kind of like you can be mad, you can be upset, but you can't be upset and mad at the people who are trying to help you. See the, you know, so um, to this day, I still go up to the fifth floor, and I see my infusion nurse. She's still there, and we hug so tight. And you know, I I only need to see my surgeon, Dr. Guth, um, if I need to. It went from seeing her every month to now only if there's something wrong, you know, something that's, you know, worthy of conversation on your mammogram. Um, so everybody serves a purpose, and it's really great. And all I have to say is just that, you know, you're not alone throughout the journey. Um, so if there's anyone out there and you just want to talk, I'm here to listen and I'm here to help as well.
Yeah. Very, very well said, Tracy. I think the most important thing that I am taking away from what you said is behind every disease is a person, and not to define someone by their stage, by
Hmm.
their biomarker profile, and to make it personal. It seems like you embody that.
I
But you know
tried.
what? It's important. We all have to learn. We slip up sometimes, and that's why it's good to also have patients remind us of that. So thank you.
Thank you.
I
Um,
think the other important thing is, Tracy, what you've shown all of us today is this was 13 years ago that you first started your journey, and yet it's so much clearly, it's so much a part of you. And I think people often think, you know, you go through cancer, you go through treatment, and you're done. And I think that's what a lot of family members, friends, or just the general public thinks. And this is just such a beautiful example of the importance of survivorship and how much this journey stays with you for your whole life. It's
Thank you.
beautifully, beautifully put. Thank you.
so, Jeff, thank you for coming. Jeff Berman is a 35-year-old cancer survivor. Through Jeff's work in cancer recovery, he co-founded the New York Terry Fox Run for Cancer Research. I've heard of that. Jeff's a commercial real estate broker. He resides in New York City with his wife Cheryl, son Judah, and the world's most stubborn but lovable golden doodle, Junior. I've got Grover, who's a standard poodle. He probably can go head to head with your dog. And he spends his spare time cycling, fishing, working out, reading history, and solving crossword puzzles. Jeff, thanks for joining us today.
Thank you. Thank you. It's a real pleasure. You know, and I'm really lucky to be the last one to speak because the stories I heard, helped ground me. Because I sit there and I think, well, I've been at this a long time. I've seen it all. I've done it all 4 times. But every time I listen to other cancer survivors, there's always there's always something to learn. Um, and in so many ways, people find so many pathways to, to survive this disease, but more importantly, thrive through the disease. And I think it was Mahata who said that, you know, she felt like she was in the in between. Well, that's sort of having cancer. And so 35 years ago, I was training for a triathlon. I was 32 years old, and I felt this lump on the side of my neck, which, you know, I assumed it was a lymph node, and I assumed since I had a lot of acne when I was younger that that's all it was. But I kept an eye on it, gave it another week or so, called my doctor. He said, "Come on in," and he said, "There's a million and one chance that there's a problem." And so I think it was the following week I had a biopsy at Beekman downtown, a place that doesn't exist anymore. So there's a lot of things and things that I'll mention that either are completely different than what it is now, or places that just don't exist. And that was a Friday afternoon, and I was training over the weekend. I never heard from the surgeon. And I was like, this is odd. And so on Monday, my doctor called me and said, come on in. I said, okay. And I walk in, and he's got his head in his hand like this. And I'm like, Dr. Newman, what's up? What's happened? You told me everything was going to be fine. He said, well, it's not. So, but he didn't know a lot about it. It was something called CLL, chronic lymphocytic leukemia. But the most amazing thing is the average age, I think back then, of people with CLL at diagnosis was something like 68, and I was 32. So what I discovered that almost every doctor I went to said to me, you just got to watch it and wait, and eventually, it'll progress. And then when you get sick, we'll take care of you. And I'm like, not working, not me. And my GP was friends with Bruce Raphael. He relatively young at the time, a little older than me, but a young hematologist at NYU who had come through training at Memorial. And I had gone to Memorial and I had a miserable experience. So we shared that. But what he said was, I've got a plan. And that is, we're going to do blood tests, bone marrow, and CTs every 6 months. So I did 13 bone marrows. He stopped doing the bone marrow when he was doing a bone marrow on me, and I told him not to use the reusable needle. I told him to use the disposable, and he didn't listen, and he bent the needle. So he was screaming at me, and I'm screaming at him, and I wish I had kept that needle, but I didn't. Anyhow, and so I had a plan at least. And I had a guy who was as big, pardon me, as big an asshole as I was. And I had somebody who could stand up to what I thought was the right way to do. And that's what I wanted. I wanted a partner in the journey. And that's what I got. So the one thing I do recall, and I keep it on my desktop, is he sent a follow-up letter to Dr. Newman. And in it, he said, at best, I give this patient a 10-year prognosis. So every time I see him, 35 years later, I always remind him. So we have this ongoing thing, and he refers to me as his 35-year experiment. So that's sort of my fortune, was finding Bruce Raphael right out of the gate at NYU. He's still my oncologist to this day. Regrettable probably on his side, but he's still there. And it's been an up and down pattern. I mean, I've done chemo over let me see, I did immunotherapy 7 years ago. And so when I was diagnosed at 32, there were two firsts. One, I was the youngest patient anybody had ever seen with CLL. And two, I joined something called the John Revere Society, because that was for estate planning. And I went to the first meeting. I was the only person in the room without a cane, but I really didn't think I had a future. So I needed to make sure what little money I had went somewhere, and I wanted it to go to NYU. And P.S. John Revere is the son of Paul Revere, and John Revere founded NYU Medical Center in 1841. So there's a little bit of history, but I don't go back that far, but I do go back many years. So I went up and down on all different chemos. I ran, in between all that, I ran 7 New York marathons, 9 marathons in total, the Boston Marathon, did all this. And you know what it did? It didn't make me any healthier, but it made me feel better about myself. It made me feel that I was alive, that I could participate in the things that I enjoy. And you hear this, it's still raw, 35 years later. And then I had another cancer diagnosis 3 years ago. But it's still raw. I've done all the talk therapy. I've run support groups. I've written a book about exercise, nutrition, stress management in 2001. We're actually working on a reboot right now. And those flyers that I can't remember who mentioned it, the flyers in the offices about exercise, that didn't exist 35 years ago. Basically, my mother really encouraged me to sit still, take it easy, relax, don't do anything. let the drug work. And I was like, no, I want to work. So what I did with Raphael, and this is what I recommend to all patients, if they can do it, is I said to him, you do the science, I'll do the health. And they are interrelated. And he looked at me like, what are you talking? I said, you're a scientist. You're a professor. You're the best doctor I could have ever imagined I would have because you're a scientist and I'm a lunatic. So together we can form a plan. And that's what we did. And ultimately, I was in a marriage that I left. I was in a career that I left. Um, and I personally, I don't look at it as cancer caused it. Cancer caused me to rethink. So I was really lucky to get that piece from my experience. Caused me to rethink, recalibrate, and as Tracy said, get toxic people out of my life and develop a plan overall. So, and then when I was diagnosed, we talked about all the magical drugs that one day may be available. And ibrutinib was one of those drugs. And I used that 7 years ago. And my CLL is mostly imperceptible, but it's still there. Fast forward to 2022, and I had had COVID a couple of times. I had my shoulder replaced a few months before, and all of a sudden I lose my sense of taste. And I figured, oh, it was long COVID. So I try to get an appointment. It's April. I can't get an appointment until August. A week goes by. Now the pain is intensifying. I call Raphael. He said it's probably acid reflux. I said, I need an ENT. Went to the ENT. He said, no, you got something back there. So I worked my way back to NYU. Bruce set me up with my whole care team. They're amazing. I mean, when a surgeon hugs you, you know you're in good hands. So anyhow, because of all the work I do at Memorial and all the money I've raised there, they said, please come in. And so the surgeon blew it. I had no interest in working with him. But the other two docs I really liked. But one thing the radiation oncologist said to me, he said, who's your radiation oncologist at NYU? I said, Kenneth Hugh. He said, you're not coming here. You're going to stay there. So I think, again, I don't want to say lucky, but having the experience of going through this all these years, I could recognize the right care team and the wrong care team. So anyhow, we went through 33 days of radiation. I did 4 rounds of cisplatin, but the most difficult part was I decided not to do any research whatsoever. I decided to do my doctor's appointments and have a discussion, a scientific discussion with them. I wish I learned a little more before I went into those appointments, but that was a brutal way to experience it. But it surefire got me where I needed to be. I mean, there were a lot of tearful moments during those appointments. Anyhow, so the last 2 weeks I tried to quit, and my wife was devastated. Everybody around me was like, you're the toughest guy I know. I said, I'm destroyed mentally. It's not physical, it's mental. I can't go another foot. And one of the techs sat with me for an hour, and I needed him to talk me through it and talk me into it. So I finished the following 2 weeks. And it was in those last 2 weeks where I lost 40 pounds. I couldn't hold food down. But the one overall piece I would tell you is that I advocated for myself, no matter how bad I felt. If I knew that wasn't the right day for hydration, I wasn't going in for hydration. So nonetheless, I still, at the depths of despair, I managed that process. So I recommend you advocate, advocate, advocate. Have people around you who advocate for you. And if you don't like what you're hearing, do something different. If it feels wrong, you have to react. You have to really think twice about it. Information is key. How it makes you feel emotionally, how it makes you feel physically. All of these things you need to experience. And then the one thing I never really counted on is the depression that I fell into. And I got to a point where it really wasn't uh, if I would have a recurrence. It was a question of when that recurrence would occur. And everybody got really concerned. They wanted me to do talk therapy. One of the somebody I'll say recommended ketamine because I said I'm 65 years old. I'm not talking. I've done enough talk. That's all I do for a living is talk. And I spoke to people about it, and I opted not to do that. And fortunately, when I hit the 2 year mark, that was last summer, it seemed to just lift. Uh, I still feel the vulnerability. And the thing I've learned, and I've done other talks like this, is we still don't pay enough attention to mental health. And the mental health part of having CLL for 35 years, having a secondary head and neck cancer, which really was a close call when I couldn't hold anything down and I lost the 40 pounds. And I didn't manage my pain properly. And one of the people said to me, "You're not managing your pain properly, Jeff. You got to fix this." She got really angry at me, which was good. And so that helped, but it was a little too late because I was chasing the pain. So that's another thing I learned. So I'm always learning, no matter how many years I've done this. And I know it may be a little disjuncted, but and then through to go back to what you mentioned about the Terry Fox run, we've been doing this for 31 years. 2 years ago, we set up a joint venture between the Terry Fox Foundation in Canada and Memorial Sloan Kettering. And I'm in Minneapolis today. I'm meeting with the Canadian Consulate. I'm meeting with the Four Seasons. We're rolling the run throughout the United States. Last year, our CAR T cell research was approved for 2 Bristol Myers drugs. There's a lot more to do. People say, "Are you proud?" I say, "Yeah, but you know what? Let's get this thing fixed in total." So, you know, to be in that position and go through all this and be able to have positive results makes it all worthwhile. You know, I think one of the questions was, what was your life like before cancer? I don't remember. Excuse me. What I would
Jeff,
say,
you're terrific. You're
what I
terrific.
would say, thank you. What I would say is that um, I didn't like that person very much when I look back at those years. And maybe because I have a point of comparison of who I am, what I do, how I feel, how I make other people feel, how I support people, how I'm supported. So all of those things, in some ways, are a result of having cancer. So there is life after it. It's a horrible disease. It leaves you really, even if you don't feel it, you're still up in the air about your life. So um, anyhow,
That was just beautiful, and thank you so much for sharing that. And one thing that I think we've heard throughout this evening is we've heard the word depression several times, but overall that is really this relentless optimism and positivity. And I think before we wrap it up, if maybe we could just hear from the panelists, what do you think drives that incredible sense of, I wouldn't say optimism, but that positivity that you all seem to have? What gets you through those dark days where you keep the fight going and you keep the optimism going? You can just hear from our panelists before we wrap this evening. Tracy, we can start with you.
Um, I think for myself, I say, um, I'm not finished. I'm not finished. You know, whether it's for myself or someone else, I just have that feeling within that I'm not done. And that's what keeps me moving forward to tomorrow and the many other tomorrows that I hope to have.
Thank you. Jeff, any last words about what keeps you going?
I decided once I came out of the, the, the sense of depression, and I wasn't depressed where I was non-functional, that there's way too much in my brain that I need to get out before I go. And that's what's motivated me.
Mahathi, we'll end with you, please.
I think for me, it's my family and friends and the work that I'm doing. I find gastric cancer to be so terrifying, as are all cancers. And I feel like what keeps me going every single day is knowing that, every day that I'm alive, I am not falling part of the bad statistics, but I'm falling into the good statistics, the statistics that I want to be part of. And I had so many issues throughout my treatment and so many complications that only 1% of patients were having those complications or side effects. And I don't want to be part of that 1% anymore. And I want to be part of this other 1%. So that's what I keep telling myself every day.
Beautiful. So I will just add that on behalf of Dr. Axelrod and Katie Grace and myself, we are not finished either. And we look forward to many wonderful, wonderful cures in the future and survivorship advances. And we look very much forward to hearing your stories year after year, and may they be good ones and healthy ones, and may everything that you hope for come true. So we are so grateful for having you on the panel, and thank you for everyone who joined us. Deborah, if there's anything else you want to add?
No, it was a fantastic panel. I enjoyed listening to everybody.